I'm Dr. Sandip. I am a consultant gastroenterologist. I work in R.N. Tagore Hospital, Kolkata. So today we'll talk on IBS. So IBS means irritable bowel syndrome. So it is a disorder of our intestine where there is usually pain abdomen, cramps in the abdomen, which is relieved after passing stool. So this is a condition which comes under functional bowel disorders. So this is very common. Around 10 to 20% of our population usually suffers from irritable bowel syndrome. And of all the cases as a gastroenterologist that I see in OPD, most of them they have IBS. Most of them usually come with this disorder. Now IBS has got various subtypes also, like some patients will have IBS which is diarrhea predominant, some patients will come with IBS which has got constipation predominant, and few patients have a mixed pattern where both sometimes they have alternately constipation and diarrhea also. Now whenever a patient comes with pain in the abdomen which is associated with altered bowel habit or pain which is relieved after passing stool, and the characteristic of the stool may be either hard stool or the patients might come with loose stools also. Now this group of patients initially when they come we have to evaluate them. We have to rule out the red flag signs like whether the patient has history of weight loss or whether the patient has other comorbidities or if the patient has blood in stool. If the patients have red flag signs like weight loss, anorexia or blood in stools, then we need to do few investigations in them, like these patients should be subjected to a colonoscopy if they have only red flag signs, or to rule out other diseases also. And usually the routine blood tests like complete blood count and thyroid profile and all this should be checked. A thorough history should be taken whether there is any history of weight loss or whether history of anorexia. Usually IBS does not have alarm symptoms. So if they have alarm symptoms, then we have to rule out other diseases. Otherwise, these patients can be treated conservatively. So once we do the investigations and rule out that there are no organic diseases, then these patients can be labeled as IBS and we can treat them as per their subtype of the disease. Now the pathogenesis of this disease, like why this disease happens, this is usually a functional disorder. So here the pathogenesis or the cause of the disease is this hypersensitivity. So these patients, they usually have anxiety disorder or someone might have depression, and most of these patients will have some psychological problems they have, or these patients they may not have any psychological symptoms also, but these patients might have a gut hypersensitivity. Gut hypersensitivity means with a normal level of gas which is produced in the intestine, or the intestine gets distended, and the intestines, because of his hypersensitivity, usually these patients complain of pain or discomfort. Now the treatment of these diseases is first of all diet. We usually advise them a diet which is low in FODMAP, or in simple terms we can tell that these patients to follow diet which is low in simple sugars, and then accordingly symptomatically we treat the patient like whatever they come with. If the patients come with diarrhea predominant IBS, then we give medicines to decrease the loose stools, or if the patients come with constipation, then usually we advise them fibers or isabgol for their smooth passage of bowel. And symptomatically, if the patient has got pain in the abdomen, usually we give some antispasmodics which can decrease their pain. And last but not the least, these patients, they have to be counseled well, and after ruling out all common diseases which can happen in the intestine, we usually counsel them and we have to treat their anxiety, and we have to tell them that you have this problem, this is a problem which we can be treated, and this is not usually a life-threatening problem. But yes, if the patients who have irritable bowel syndrome, usually they suffer a lot, and because of this their work capacity decreases and other problems can happen. So that psychological counseling is also important. And of course all patients we should not label as IBS. First of all, we have to do a few investigations and we have to rule out the organic diseases.